So, on to what the common injuries are of the shoulder. And I like to separate them into two types of injuries. One of them is acute or traumatic, which is I fall on the ice and break my shoulder, or car accident, or playing sports and getting hit in the shoulder and getting that immediate injury. And those do happen pretty often, but most what we see here in the clinic and what I treat is chronic or repetitive stress injuries, which are one of those things that you don't really know exactly when it happened, but you wake up one day and you have pain, or it just slowly starts to get worse and worse and worse over time. And those are the most common things that happen in the shoulder, and those are the rotator cuff impingement syndromes, which we're going to discuss, osteoarthritis, tendinitis, bursitis, and shoulder instability, which can develop over time. So the first thing is the shoulder impingement, or we can also refer to it as tendinitis, or could be also bursitis. But basically what it is an inflammation of the tendons in the shoulder that can get kind of pinched up when you put your shoulder in certain positions. And this here is a picture of one of the tests that we do to test for shoulder impingement, where we put the shoulder in a certain position, which causes pressure on the rotator cuff tendons. And if the person feels pain, that's one of the signs that maybe they have what's called a shoulder impingement. The treatment with that is usually anti-inflammatories. Therapy would consist of seeing if there's any weaknesses or decreased range of motions, possibly, and kind of trying to address those things, as well as trying to figure out if there's any repetitive activities that may be causing the shoulder to be irritated or inflamed. Osteoarthritis is a common complaint of more an elderly population, but it can happen a lot of times when people put their body through a lot of stress, a lot of heavy lifting through a life. It's especially when people do a lot of overhead type lifting, you can develop osteoarthritis, and commonly it happens in this joint, in the AC joint, with a lot of overhead lifting. Rotator cuff tears are also, one of the most common problems that we see in the shoulder, and that is those rotator cuff muscles that we talked about from overuse or from traumatic injury can have a little tear in them, and that can happen in a lot of different parts of the rotator cuff. Any different muscle can happen, and depending on where it is, the person will have certain symptoms, maybe different than somebody else with a rotator cuff. So treatment for that, again, is to do a good diagnosis to see what muscle may be torn or where the tear may be, and address that first conservatively. If conservative treatment, which usually consists of strengthening and range of motion work and calming everything down, doesn't work, then we would refer the patient to an orthopedic surgeon to do an MRI and possible surgery at worst. Of course, we always try to avoid that. The last one that I want to discuss is a frozen shoulder, which is not as common, but it does happen to people that have sometimes irritation for a long time. And what a frozen shoulder is that capsule that we talked about that surrounds the shoulder joint. That whole capsule can actually get very irritated and red and really hot. And what happens with that person is they lose a lot of range of motion, very painful, usually can't move in any direction, and frozen shoulder has to kind of run its course, and it goes through 3 different stages. The first stage would be the freezing stage, when it kind of starts getting bad and starts getting really tight and painful. The frozen stage, when it's actually frozen, which can last for a few months. And then the thawing stage, when it starts to gradually improve. And the whole process could last for about a year, 14 months sometimes, not uncommon. Treatment for that would be sometimes injections for anti-inflammatory, and then physical therapy consists of very gentle mobilizations and very gentle exercises as kind of the person goes through the process. And then once everything starts to thaw, we start to kind of address range of motion and kind of get everything back to strengthen everything up again. So, what are the risk factors of developing any of these terrible shoulder problems? Number one is previous injury. So if you've had a previous shoulder dislocation, previous rotator cuff tear or injury, you're more likely to kind of develop shoulder problems in the future, and that's kind of indicative of all injuries. Back pain, knee pain, kind of all fall in the same category. Posture is one of the first things that we look at when people that come in with shoulder pain, because that can really affect the way that the shoulder mechanics, the shoulder works, and the way that it's able to operate. So people that have very forward shoulders or very extended, or sometimes even lumbar posture, if you have a super really big lumbar lordosis, that can affect the shoulders, if you see in the picture. And every type of posture affects the shoulder differently, and we address that on an individual basis. The next thing we always look at is range of motion. I love this picture because it's one of the first things that I do with patients when they come in, is I try to have them see if they can touch their hands behind their back, touch their fingers behind their back like so in the picture. And a lot of times people aren't able to do it, and they have no idea that they can't do it until I ask them to do it. And that's something that's important. If you don't have the range of motion, certain things have to make up for it, and then again we can see those repetitive stress or those overuse type injuries. Repetitive activities are a really big risk factor for shoulder problems, and one of them is the mouse. And it doesn't have to be something heavy, but it could be just something that you do over and over and over, whether it's you always hold the phone a certain way, whether you always reach in a certain direction, you sit in a certain spot. A lot of times people always sit and they drive, if they work as a driver, and they always sit with their shoulder up like this. When you're home, you always sit on the same side of the couch. You always sleep on the same side of the bed, on the same side, on the same shoulder. You're always doing the same thing over and over and over, and it may not hurt in the first 100 times that you do it, but sometimes it starts over time, can give you a little irritation. Repetitive activities with sports. A lot of our sports are very one-sided, whether it's tennis, whether it's volleyball, or whether it's pitching or baseball. That can, again, repetitive activities, repetitive stress, the same tissues kind of get used over and over, and that can cause some irritation. Poor body mechanics, whether it's in the gym or it's in your daily life. If you're not minding your mechanics, sometimes you can overuse certain tissues and cause injury.